All right, good evening, everyone. Today I'll be giving you a quick overview of tuberculosis or TB and what you need to know to protect yourselves, our patients, and the community. So, what exactly is TB? Tuberculosis is caused by Mycobacterium tuberculosis, which is a slow growing bacterium that primarily targets the lungs but can spread to other organs. There are two main forms you need to know about. There's latent TB infection and active TB disease. Latent TB is like it's a sleeper cell, so the bacteria are in your body, but they're not active and they're not contagious. But active TB is when people have symptoms that can spread the infection to others. And the most common symptoms you see may include fever, night sweats, unexplained weight loss, and these can last upward of 3 or more weeks. And globally, tuberculosis is still one of the top 10 causes of death, which shows how serious it can be if we can miss it early. Who is most at risk? So, people with a weakened immune system, such as those with HIV, are at a much higher risk of developing active TB, as well as close contacts of someone with active TB and people living in congregate settings, for example, unhoused shelters, long-term facilities, or long-term care facilities, or prisons, are also incredibly vulnerable. And healthcare workers, even in low incidence countries, healthcare workers are exposed more often than the general population simply because of the field that we work in. So that is why good infection control practices are so important. So, transmission, testing, and the contagious window. So, how does tuberculosis actually spread? Tuberculosis is airborne, and when a person with active pulmonary or laryngeal TB coughs, sneezes, or even talks, they release tiny droplet nuclei into the air, and these can linger in poorly ventilated spaces and be inhaled by others. And a person with tuberculosis is considered contagious until they've been on effective treatment for at least 2 weeks and are showing clinical improvement. And for testing, generally a TB skin test or a blood test like an IgRA are used for screening. If someone has symptoms or their skin test comes back positive, then a chest X-ray and sputum testing is used to confirm the diagnosis. So why this matters to us, so even one untreated person with active TB can infect up to 10 to 15 people each year, and healthcare workers have been shown to have 3 times the risk of TB infection compared to the general population due to occupational exposure. And the bottom line is that early recognition protects everyone, yourself, your coworkers, and vulnerable patients. Missing one case could lead to an outbreak in a healthcare setting, so it's important to understand and know the signs of TB. So, protecting staff and infection control. So, how do healthcare staff protect ourselves? So, the most effective approach is administrative controls, which is basically stopping transmission at the source. And that means recognizing TB risk factors during triage, isolating suspected cases immediately, and making sure patients start treatment as soon as possible. And next is personal protection. So N95 respirators or high-level respirators, such as PAPRs, every time you're caring for someone with suspected or confirmed TB should be used. Fit testing and wearing the respirator correctly made for your face makes a huge difference. And then finally, environmental controls. So place suspected TB patients in airborne infection isolation rooms with negative pressure. Ensure there's good ventilation and consider UV germicidal irradiation where available, as well as daily disinfection of high touch surface areas using EPA approved products. And these are my resources. But to wrap up, TB may not be something that we see every day, but we still need to stay vigilant. If you think you see a patient with risk factors and persistent respiratory symptoms, use proper PPE, follow isolation protocols, and contact infection control if you ever suspect a case. By recognizing cases early and protecting ourselves, we protect our patients and our community. Thank you.